Hello, my name is Archimedes Munzalan. This will be my physical examination video for our NR 509 class. Before we start, let's take a look around my room. Make sure I'm not using any aids and any visual helps and tools. Okay. I have here Mr. Marley Maraquin. As his guardian, I do authorize Chamberlain College of Nursing to use this video for grading purposes. And let's begin. I'll be looking at Marty's head, noting that there's no discoloration, it's midline, and no lesions or anything like that. That's good. And now we can move on to palpating his lymph nodes. So starting off, I'll be checking the preauricular lymph nodes, which is in front of the ear, postauricular lymph nodes in the back of the ear, occipital lymph nodes in the back of the head, tonsillar lymph nodes. Moving down to the jaw, under the jaw is a submandibular lymph node. Under the chin is a submental lymph node. And in front of the neck is the anterior cervical lymph node. In the back is the posterior cervical lymph node. And on top of the clavicle is the supraclavicular lymph node. I'll be noting for symmetry and size, noting that there's no swelling and they're okay in size. And that's good. Now we can assess cranial nerve number 5, which is the trigeminal nerve. It's got two aspects. It's got a motor and sensory. For the motor function, I'm just going to ask Marty to clench his jaw. And palpating in there, the masseter is good and equal in strength. No problem there. And for the sensory portion, I'll be asking Marty to close his eyes and I'll be touching his face and he'll tell me where he feels it. Go ahead and close your eyes for me, Marty.
Forehead, nose, chin, left cheek, right cheek.
Very good. Cranial nerve number 5 is intact. We can move on to cranial nerve number 7, which is the facial. Marty is going to make some faces and I'll be observing it. So go ahead and smile, frown, puff your cheeks, lift your eyebrow, pucker your lips. Good. And with this cranial nerve number 7, we're going to be assessing for symmetry, and his facial expressions are symmetrical and intact, and that's good. Now I'll be looking at Marty's ears. I note that they are symmetrical, there's no redness or swelling, and they're intact. And I'll be using an otoscope to look at the auditory canal. All right. For this, I'll be pulling up and back. And looking at the external auditory canal, I see that there's no redness, swelling, no drainage, and cerumen. It's intact. Looking inwards more, I see the tympanic membrane is pearly gray in color, and the internal auditory canal has no effusions. Moving on to the other side, using the same technique, I'll be pulling up and back. And the external auditory canal is clear, no swelling, no redness, and no drainage or fluids, and no cerumen.
I don't have an answer.
The tympanic membrane is pearl gray in color, and the internal auditory canal has no effusion. I'll be palpating his ears, testing for any tenderness. On the pinna, any tenderness?
No.
And the tragus, any tenderness?
No.
Good. And now we can move on to cranial nerve number 8, which is the auditory cranial nerve. With this, I'm going to ask Marley to cover one of his ears, and as I dictate numbers behind him, he will repeat back to me. So go ahead and cover your left ear.
1, 2, 3,
All right, cover the right ear.
4, 5, 6.
All right, good. Cranial nerve number 8 is intact. Now I can go ahead and look at Marty's eyes, starting with the conjunctiva. We push down. I see that it's pink and moist. It's not swollen. And the sclera is white and intact. With that, I'm gonna move to assessing cranial nerve number 2. For his visual acuity, I'll be using a Snellen chart. And I'll ask Marty to cover one of his eyes. And each eye he'll be reading the line for me. So go ahead. I'll be stepping 6 feet back. Can you read this line for me and cover your right eye, please?
LTFPH,
Okay, cover your left
LTFPH,
and open them.
LTFPH.
Good. As we can see that Marty's visual acuity is 20/20 on the right, 20/20 on the left, and 20/20 on both eyes. And that's very good. Now I'm having Marty stand up. I'll be checking for his peripheral vision. And with this, he'll tell me when he sees my hand. Can you see?
No.
Right here?
Yes.
Okay.
No. Yes.
Okay.
No. Yes.
Good. So that is good for cranial nerve number 2. Now we'll be checking his ocular motor, cranial nerve number 3, which is his reactive to light. I'll be shining his light into his eye from outer to inner. And as I shine his light through his eyes, I'll be noting for his pupil that's constricting to light. It's good. And it should constrict 2 to 3 millimeters, and those are intact. To further assess the eye, we'll be checking the extraocular motor, and that involves cranial nerve number 3, 4, and 6. So ocular motor, trochlear, and the abducens. And with that, I'll be doing a star or H pattern. I'll have Marty look straight into my nose and follow my right hand as I move it. So go ahead and let's do that, Marty. Look at my nose. I'll be doing a pattern just with your eyes. Okay, follow my right hand. Very good. So cranial nerve 3, 4, and 6 are intact. Now I'll be looking at Marty's nose. I see that it's symmetrical, intact, no swelling, no fracture. And I'll be assessing the internal nose using an otoscope again by pushing up on the nose. You see on the left side of the nose, I look at the turbinates. They are pink and moist, no swelling. And as I go in anteriorly, I look at the septum. It's straight and it's not deviated. It's good. I'll be doing that on the other side as well. Pushing up. Okay, looking at the turbinates, they are pink and moist, no swelling, no redness. And moving in closer to the septum, that I see that it's not deviated and it's straight. After we check the nose, we'll be checking his mouth. Oh, sorry, I'll be palpating his sinuses. So we have the frontal. Any tenderness?
No.
Okay, and the maxillary. Any tenderness?
No.
Good. All right, so now we can move on to the mouth. I'll be looking at Marty's lips. I see that they're symmetrical, they're pink and moist. And go ahead and open your mouth, please. Looking at his teeth, I see that they are intact. There's no cracks in there. And then looking at his gums, they're pink and moist, no swelling, no redness. Okay, looking inside, I see both mucosa mosa is nice, pink, and intact. There is no swelling, no drainage. And the tongue is, stick your tongue out, nice and smooth, good. And the upper and lower palate, the hard and soft palates are intact. And the posterior pharynx is, there's no postnasal drip in there. And the oral mucosa is intact and no drainage as well. To further assess the mouth, we won't be checking for the gag reflex, that's cranial nerve number 9, hypoglossal, but I will be assessing cranial nerve number 10, which is the vagus nerve. To assess the vagus nerve, I'll have Marley open his mouth and he'll say ah, and I'll be looking at the uvula. Go ahead and open your mouth. Stick your tongue out. Say ah. Good. So with that, the uvula, I note for symmetrical phonation, and that was okay. All right. So now let's go ahead and close your mouth for me. We'll be checking cranial nerve number 12 is the hypoglossal, and go ahead and stick your tongue out side to side. Okay, good, and that's intact. Now to further assess, we'll be looking at Marley's neck. I see that it's symmetrical, and that's good. And we'll be looking at his trachea. It's midline and intact. That's good. Now we can move on to assessing his thyroid. Sorry. So with the thyroid, we're going to be to locate the thyroid, we're going to look for the cricoid process and the substernal notch in the middle. And in between that, we're gonna be retracting on each side. So 2 fingers here on the right and on the midline. And I'm gonna ask him to swallow. I'll be noting for size and nodules. I'll be doing that as well on the other side. So we're checking it bilaterally. Cricoid process and the substernal notch. And then I'll be retracting on the right, pulling in, and go ahead and swallow. Good. So there's no nodules and the size is okay. Now we can move on to palpating his carotid arteries. Okay, be checking on the right, or on the left, I'm sorry. On the right. Note for equal strength bilateral and they're bounding, that's good. Now we can listen and auscultate the carotid arteries. So auscultate the carotid arteries, I'll be using the Bell stethoscope. And with this, I'm gonna ask Marty to hold his breath so it does not interfere with the examination. Hold your breath. Okay. Hold your breath. All right. Carotid arteries have been auscultated, no bruits were heard, and that's a normal examination. And that's good. Now, we can move on to, sorry, brain fart. Now we can move on to checking the range of motion of the neck. So Marty, just look straight for me. Have your chin point down to your chest. That's your flexion. Now back normal. Chin up to the ceiling. Good. That's your extension. Look to your left. That's rotation. And look to your right. Okay. Now have your left ear to your left shoulder. Okay, that's internal flexion, and right ear to the right shoulder. Good. To finally finish off, we're going to be assessing cranial nerve number 11, the spinal accessory. I'll be putting some weight or tension on the shoulders. I'm going to just ask them to shrug up just to check for strength. Go ahead. Good. 5 out of 5, and they're symmetrical. Now we can move on to auscultating Marley's heart. And this one, we'll be using the Bell and the diaphragm, and I'll be checking the 5 areas. So starting off with the diaphragm, on the right sternal border, second intercostal space, is the aortic valve. And on the second intercostal space on the left sternal border is your pulmonic valve. Down to the third intercostal space on the left sternal border is your Erb's point. Down to the fourth intercostal space on the left sternal border is your tricuspid. And for the mitral area, it's going to be on the left sternal border, looking at the mid-axillary. Okay, we're going to repeat the same process using the Bell. On the right sternal border, second intercostal for the aortic. Left sternal border, second intercostal will be your pulmonic. Left sternal border, third intercostal space will be your Erb's point. Left sternal border, fourth intercostal space would be your tricuspid. Left sternal border and between the mid-axillary line on the fifth intercostal space would be your mitral area. All right. Upon auscultation, you should hear normal heart sounds, no murmurs, no ticking, and that's a normal exam. Now I can look into Marley's chest and inspect that there's equal and symmetric in rise. We can go ahead and proceed to listening to his lung fields and posterior and the 6 lung fields. I'm gonna ask him to breathe in and exhale through his mouth. Inhale, please. Good. Inhale. Inhale. Good. Inhale. Breathe out to your mouth. Good. Inhale. And inhale. Very good. Now let's go ahead and check his back, also take the back of his lungs. Go ahead and turn around for me, Marty. Thank you. And to assess the back, we're going to start under the scapula. We'll be checking the 8 regions here. Doing the same thing again, okay, Marty? Under the scapula, breathe in. Good, out to the mouth. Breathe in. Out to the mouth. Breathe in. Out to the mouth. Breathe in. Okay. We'll be listening to the right middle lobe. Go ahead and breathe in, out to the mouth. And make sure we listen to the lung bases as well. Okay. So upon auscultation, it's got normal breath sounds and no other adventitious breath sounds were auscultated. And that's very good. Now we can move on to checking Marley's hands. Go ahead and stick your hands out for me. So looking at his fingers right now, I see that there's no redness, swelling, no tenderness on his joints. I'll be checking for his capillary refill. To check for capillary refill, you need to press on the finger, make sure the fingernails turn white, and upon releasing, the color should change in less than 3 seconds. That's good. I'll be doing that on the other side as well. Pressing in, turning white, release. All right, good. So capillary refill is good, less than 3 seconds bilaterally. Now let's have you push your palm up towards me. Good. I'll be checking his radial pulses. 2+ bilaterally and equal. That's good. Now go ahead and grab my hand. Great. So strength is great. And then I'll be checking for his range of motion on his arm, his elbow. So you have flexion, extension. That's good. And now we can move on to range of the strength of his elbows. Go ahead and put your elbows up. Can you pull? Good. Push. Great. So 5 out of 5 strength right there. Now we can move the assess for the range of motion on the shoulder. So we have flexion, extension, internal rotation, external rotation, adduction, abduction. And that's good. Now we're gonna check for cerebral reflex. That involves Marty moving his hands. So go ahead and put your thumb to your fingers. Okay, do it as fast. Okay, faster. Great. Now with your palm down, flip them up and down. There you go. Good. So that's intact as well. After assessing that, we can check for the deep tendon reflexes. So beginning with the arm, I can assist him by putting my hand on the right and anterior cubital fossa using the pointy end of my hammer. I'm going to be striking there. Oh, good. That's a reflex. And then on the knee, under the patella, I'll be using the dull end of my hammer, the flat end. Okay. Oh, that's a good one. And on the Achilles, I'm going to dorsiflex a little. I'm going to hit the back side right here with the flat side. Okay, good. So deep tendon reflexes are intact, and that's good. Now we can go ahead and check his abdomen. Go ahead and lay down for me, Marley. Just a little lower, please. Okay. Oh, can't see Marty. Split that, Marty. That's good. That's good. Okay. I'll be inspecting his abdomen, looking at curvature, and there's no distension. It's good. Now I can listen to the quadrants of his abdomen. There's 4 quadrants I'm listening to. Right upper, left upper, left lower, and right lower. Okay. All bowel sounds are heard and present. That's good. They're active. And now to assess further, I'll be listening into his renal arteries. Now to listen to the renal arteries, we have to use also the bell to check for bruit. And starting with the aortic region, that's under the xiphoid process. Okay. Moving on to the right renal, which is on the right intercostal above the umbilicus. Oh, sorry, that was the left on the above the umbilicus, and then on the right, moving on to the right, on the intercostal space above the umbilicus, and then to assess the left iliac, which is under the umbilicus on the left side, and on the right, under iliac under the umbilicus. Okay. No bruit was heard, and that's good. Now I can move on to percussing. Percussing the quadrants and making sure with my hand down, tapping it. There's no tympani, and it's not okay. It's good. And move on to palpation, checking for tenderness. Okay. All right, so that's normal. Now, after doing that, we're going to be doing the Romberg's test. That's 90 degrees down on his belly, and if there's pain in there, that indicates a positive test. And in that case, it's normal. That's good. Thank you for that. Now, we can move on to assessing his lower extremities. As you can see that they are no swelling or edema on both legs. No swelling or edema on both legs. And now I can move on to assessing the hips. We're not going to be doing extension, but we're going to do a flexion. So we're going to go internal rotation, external rotation, adduction, abduction, and then moving down to the knee, we're going to do flexion, extension. It's good. And then go ahead and bend both of your knees. You're going to push against me, pull, and push. All right, 5 out of 5 strength there. And for the ankles, I'll be checking on both for passive range of motion, plantar flexion, dorsiflexion, rotation. Good. And do that on both sides. Plantar flexion, dorsiflex, rotation. I'll be checking for his pedal pulses on both sides. Okay, +2 bilaterally. And we'll be checking for strength as well. So go ahead and push and flex, okay? And pull back. That's good. 5 out of 5 strength bilaterally. Now let's go ahead and stand up for me, Marty. Okay, I'll be checking his spine. Go ahead and turn around. As I go down around the back, I expected normal curvatures. That's good. Okay, now turn around. We'll be checking for flexion. Go ahead and touch your toes. Good. That's flexion. Go ahead and lean back. Very good. Extension. Turn to the side. Just your hips. Just the top, the torso. Good. That's your rotation. And lean to the side for me. Okay. Other side. Good. So his spine is normal. That's okay. Now we're gonna do hands to the side for Romberg's test, and close your eyes. We're gonna note for any swaying or anything like that. Good. There's no swaying, so that's negative. And now, last but not least, I'm just gonna have Marty take a few steps forward and turn around, just as per gait. Very good. All right. Well, thank you for that, Marley. And that concludes our physical assessment video. I hope you enjoyed it. Thank you.